we are in a unprecedented period of time in human history across the world. All the countries are facing a double crisis. Initially, we have a health crisis caused by the COVID-19, and now it leads to an economic crisis. And WHO has also declared that we are in a pandemic situations right now, and lots of healthcare issues and lots of social distancing restrictions are in place across the world. And this has actually caused a mental health impact on populations. And a lot of the time, mental health conditions arise because people are feeling uncertain, especially uncertain about future, uncertain about what's going on to their life, their jobs, their family, their social life. And also they have a feeling that things are not under their control. So common mental health issues such as depressions and also anxiety are commonly seen, in populations during the period of crisis which you are facing right now. In terms of working performance, the impact is severe if someone have a mental health condition such as severe depressions or severe anxiety that left untreated. Now, it can affect work performance in a few levels. So, as I mentioned, there's loss of concentration, loss of focus. So people will find it very difficult to focus on their work, and that will actually have impact in terms of the level and the quality of work they produce. And at the same time, the relationship with the colleagues can be affected as well. You can get easily agitated just by small issues or small matters, and that will actually has an impact on the interpersonal relationships. Yeah, and in terms of your personal relationship with your friends, with your family, sometimes because of the constant feeling of anxiety and also feeling depressed, you tend to just hide yourself away instead of talking to people. So actually that instead of talking more to people, to share your feelings with other people, you tend to just become very withdrawn from people. You tend to reduce your interactions with people, and because of that, the relationship sometimes can become distant, and it becomes like a vicious cycle. I think it is important first for us as a healthcare professionals, as a healthcare community. It's very important for us to raise awareness of mental health, especially during this special time, of double crisis, the health crisis and also economic crisis. We know people are in difficult situations, people are facing challenges, but these people, they tend to focus more just on what's going to happen to my job. Am I going to get pay? Is my boss going to reduce my pay? So they tend to be very fixated on all these day-to-day happenings, issues. They might neglect their mental health or their physical well-being. So us as a healthcare community, healthcare providers, I think we have a responsibility to actually increase the awareness in terms of mental health conditions. They need to know, what are the signs and symptoms to look out for in different aspects, mental well-being, physical well-being. And as long as they're aware, they have the knowledge, then they know what to look out for, and then they will be able to go to the right channel to seek help. And also at the same time, they can also implement some kind of self-management.